You are listening to You Restored with Dr. Kelley Reis. To listen to all episodes, visit libertynaturalwellness.com. On this episode of You Restored, I want to talk about something that pretty much all of you have heard about, but honestly, most people don't even know what it means. Let's do an experiment. What goes through your mind when you hear the words leaky gut? Oh yeah, I've heard of that. My midnight scrolling because I'm trying to figure out why I don't feel well. I've come across leaky gut. I've mentioned it to a friend, maybe a doctor who probably rolls their eyes. And I think I have it, but I don't even know what that means. I've been in practice 22 years. You guys know that. And I've known about intestinal permeability or leaky gut for that entire time. It's gaining traction now because people are starting to understand, I think I have that, but nobody knows what it means. So today I want to get to the nitty gritty and help you understand what that means. Let me describe to you a really common patient that I would see. Female, comes in with a diagnosis of Hashimoto's maybe, has brain fog and maybe some joint pain. Really common scenario that I see. And when I ask about her digestive system, she's like, well, I don't have any issues. And she's surprised when I bring up, this could all be related to your gut. That's a big surprise because she has no digestive symptoms that she knows of. But this is where leaky gut comes into play so much. And people don't understand that. Let's break down what that actually means. What is a leak in the gut? So we think of the digestive system as a tube. And that's okay to think of it that way. However, if you think of the intestines as more of a wall, kind of a fortress, it is a one cell thick wall, one cell. It's super thin, but it is super important that that one cell wall is solid, absolutely solid. That wall is made up of cells that are glued together. Cells glued together all along it. So we have a tube. That wall is made up of just cells. And they should be really glued together. And those are called tight junctions where those cells meet and are glued. Leaky gut is when that fortress, that glue comes undone. And those cells start to break apart. Once again, those cells are meant to be glued together, but they break apart. Inside that wall, you have receptors. The normal, healthy gut wall, you have things that are broken down by the digestive system, and that those particles, it might be vitamins, fats, all sorts of nutrients that need to get from the gut into the bloodstream. The bloodstream's just exactly on the other side of that one cell thickness of that wall because that's the highway. Needs to get these nutrients throughout the body. So we have receptors inside that wall where things are supposed to sit on receptors. They get sent through. It's kind of like a key opening a door. If the key works, that is sent through to the bloodstream. That is a healthy gut. An unhealthy gut is when those cells break apart and everything can get through to the bloodstream. I like to visualize it like this. I think this is, often really helpful. So imagine you have a garage door and you have a walk-through door right next to that garage door. But you keep the walk-through door locked. It's closed, it's locked. But the garage door's up. Everybody and their brother can come into your garage and into your house because that garage door's up. They're not going to care that the regular door is closed. They're like, I'll just walk through the garage. So tractors can go into your garage, people, so all sizes of things can get from the digestive system into the bloodstream. Undigested food, toxins, bacterial toxins, dietary toxins like pesticides, they're just flying on through into your bloodstream. That is why the integrity of the gut wall is absolutely crucial. It's crucial. One thing the body makes is a protein called zonulin. And zonulin's job is to loosen the pathways through the cells a little bit, just enough. Some things go through. It is necessary to actually allow certain things to go through. The challenge is when zonulin gets high, and I test that in GI maps on purpose, because it's a really, really important protein to understand. Correct amounts of zonulin, crucial. High amounts of zonulin, problematic. And high amounts of zonulin, now we get the breaking apart of those cells and big gaps in between that crucial wall, fortress wall that keeps things out. Now, how do we get high zonulin? Broken record here, sympathetic overdrive. So chronic stress releases zonulin. Don't control your stress, have higher zonulin, leaky gut. So sympathetic dominance or just chronic stress. It doesn't have to be you're always, in that sympathetic overdrive that I've talked about, but chronic stress, maybe it's more short term, but it's still considered chronic and you have increased zonulin. Gluten, I think it's glyphosate, honestly, but gluten is known to release zonulin in great amounts. So we have all sorts of stuff that are releasing zonulin. Hormones, unbalanced hormones are going to release small intestinal bacterial overgrowth. So these bacterial, like a bacterial overload, releases zonulin. Zonulin opens that garage door, breaks those cells from being glued, dissolves that glue, allows things to your bloodstream, and causes all sorts of reactivity. Now, this is often missed. And it's because what I said in the beginning, it's often missed because not everybody reads the textbook. And what I mean by that is not everybody is going to have gut symptoms. When I see someone come in with autoimmune issues, thyroid issues, brain fog, joint pain, first thing I think of is leaky gut. I mean, I've told you all over and over again, the gut is really such the center, and then sympathetic overdrive. Those two things, very, very important to know. But this is missed because number one, conventional medicine is stuck on specialties. Your endocrinologist isn't going to look at it. Your neurologist isn't going to look at it. I mean, these specialties all should. You won't be sent to a gastroenterologist if you don't have digestive symptoms. Now, functional practitioners will look for it, but honestly, I don't think a lot of functional practitioners really understand what leaky gut is. They just give a leaky gut supplement, some of the generic supplements for leaky gut. Are we really assessing? Are we retesting to make sure that zonulin is low and Akkermansia, a really important bacteria that prevents leaky gut by making sure the mucus lining, I call it a sealant. So the tube, we have also a sealant laid down that makes that wall even more, makes it stronger. So we miss it a lot. We miss, leaky gut a lot. It's a big deal. I mean, I went into naturopathic medical school. Intestinal permeability was really important 27 years ago, but now it's getting, so much more press so that people are like, oh, I think I have leaky gut. Well, what does that mean for you? I don't know. I just know I think I have it. So the lack of gut symptoms doesn't mean it's not seated in the gut. There's so many signs that leaky gut is a culprit outside of gut symptoms. As I was saying, what gets through and why this matters. So we have bacterial pieces, lipopolysaccharides. These are byproducts of broken down cell walls of bacteria. Pesticides, bigger food product that should have been broken down and it's not. Medication components. Things get through because that garage door is up and everything's getting through. And what does that do? It gets in the bloodstream. The immune system starts right then and there. It does exactly what it's supposed to do. It attacks foreign things. It doesn't know what these big pieces are now. It's like, I've never seen that before. I don't know what that is. So it engages and activates the immune system. That's why we see systemic issues when we have leaky gut, because that immune system is doing its job. It is like, these are all foreign products. Oh, I recognize that vitamin, but boy, what is that? And it's very activated. So immune activation is a real issue. We see leaky gut associated with pretty much all systemic issues, all of them. And that's why you really have to address leaky gut. It is crucial that leaky gut is thought of as a central root issue in pretty much every reason that people come to see me. I think of leaky gut, for sure. It is absolutely crucial. You think you have a thyroid disorder. You think you have joint pain, and I'm going to use quotes here, just a thyroid disorder, just joint pain, hormonal issues, anything you can think of, skin issues, anything like that. That is, I would say, more chronic issues. I mean, acute issues can certainly have leaky gut implications, but the chronic issues that you're dealing with and your functional provider is aiming at that issue itself, aiming at the thyroid, aiming at the hormones, aiming at the skin, they are missing a very likely culprit. And that is leaky gut or intestinal permeability. So we've got to take this very seriously. We've got to test for it. We've got to understand it, and we have to correct it. You want long-term issues. You wonder why, well, I'm on thyroid meds. Why do I not feel better? Why do I still have brain fog and fatigue and joint pain when I'm being treated? But they're missing a huge puzzle piece from the gut. Dr. Kelley Reis, this is You Restored. Make sure you're looking at that gut.